All right, to say that we've seen a lot of changes in the past 2 years with COVID is like totally such the understatement. From testing to booster shots, what about the next few months? Are we going to see yet another spike? Joining us for today's To Your Well-Being is Dr. Wyatt, the Chief Medical Officer for Moses Cone Hospital. All right, first and foremost, let's just talk numbers because, you know, we haven't been doing numbers updates as often as we had before. So what do they look like now compared to a few weeks ago?
So thank you very much for having me, Tanya. The COVID numbers within our hospital system and also in the Guilford County area have all decreased over the last several weeks. However, over the last week or so, we have seen a slight surge in the numbers going up, but not in a way that is really scary right now.
Not in a way that is scary.
That's correct. Not in a way that's scary.
That's good. I want to clarify that because, you know, with recent Easter gatherings, spring break trips, we are kind of thinking to ourselves, are we going to see an increase in COVID cases in the next couple of weeks?
We may. It really sort of depends on what the status is or was of the people that did gather. Were most of the people vaccinated? Some people still are using masks, and whether or not they use masks during their gatherings, they may or may not see that bump. But with the new variants that we're seeing, there's a good chance we might see a slight spike.
A slight spike. But again, we want to say that at this point, it's not a concerning increase as of yet.
No, it is not.
Okay, this is good news. All right, so if you learned, though, that someone you spent time over the holiday with, traveled over spring break with, is now sick, what should you do?
So first thing you do is monitor your symptoms and then sort of assess how much contact did you really have with that person? Were you in an enclosed space around them for prolonged periods of time? Were you wearing masks for any of that time? And if there is a significant risk that you may have been exposed and it's a few days later, it's good chance that you probably should get a test. You can do a home test, and actually that sort of occurred with my family, where my daughter, who had been hanging out with some friends, tested positive. We ended up, both my wife and I tested negative, but because she had been home for a while, we went ahead and tested.
See, it happens to doctors too, right?
That is correct.
It happens
more
than
just me. Yeah.
Yeah. All right. So let's talk about COVID variants. Should we be concerned about what we're now hearing about, which is that BA.2 variant?
What we've heard and what we've learned about the BA.2 variant is that it is very transmissible, very contagious, but we haven't seen the level of virulence to make it something that's scary as of yet. Certainly people who are immunocompromised or at risk of getting sick should be very careful about this and continue to protect themselves in all the ways that we've talked about. We can talk about some of them again, but in terms of its transmissibility, it is a very transmissible virus.
Okay. And when we talk about boosters, because there's still a lot of people who are now eligible for an additional booster, who is eligible for it, and then why should they get it, and when should they get it, you know, after their last shot?
So the recommendation now is that for anyone over 50 years old should get a second booster. Now, the first booster, after you've gotten a full set of the vaccine, either the Moderna or the Pfizer, can be done anywhere 4 weeks after you've received your full, initial dose. That is recommended for anyone 12 and over.
Okay. So do you anticipate then that additional boosters will be coming available for other age groups soon, since right now it's just 50 and over?
Possibly. They still have to analyze the risk benefits for those age groups. And I misspoke. It is actually for 18 and older for anyone getting a booster. And then they do recommend it for people over 50. But if you are in that sort of 5 to 12 age range where you've got the initial vaccine, we're still not recommending the booster yet.
Okay. And then do we have any update on the vaccines for children under the age of 5?
Just that they have not found that risk-benefit number to say that it should be recommended for them.
Okay. Let's talk about some of the new things that have been coming out COVID testing wise. Recently, there was a COVID breath test that was approved by the FDA. What can you tell us about that?
Well, so far it looks pretty good in terms of its ability to detect the virus and also to be somewhat specific for people who don't have the virus. It is not widely available yet. I'm not quite sure when that will be, but it will be part of our armamentarium against this virus in terms of testing as soon as you can when you need to.
Okay, so people are going to be looking ahead to summer plans, summer vacations, maybe taking a plane trip, that kind of thing. What steps should people take now to help keep the numbers low going forward so that we can have as healthy a spring and summer as possible?
The number one thing is to make sure that if you have not been vaccinated, or if you're eligible for the booster, or you haven't completed the series of vaccinations, to get vaccinated. And then in the proper settings where you're around people with unknown vaccination status or COVID status, probably best to wear a mask if you're in enclosed settings.
Okay. Well, Dr. Wyatt, he's going to be with us until 6 o'clock answering all your COVID-related questions. We want you to be able to text those questions directly to us so that you can get your answer right on the spot. The number is 336-379-5775.